Hello friends, I am Dr. Chabra. I am going to discuss about the auricular therapy, how it is superior to acupressure, how it is different from acupressure, how it came. Little brief. Friends, in acupressure, we treat the points on the body. Acupressure is a very old therapy. After acupressure came reflexology. It was found that same points which were on the body are on the foot also, and the therapist started on the foot, called it reflexology. Then came Suzuki. People started treating on the hands. Results were still better. Then came auricular therapy. It was seen that same points which were on the body or foot or on the palm, those points are on the ears as well. This therapy is called auricular therapy. Auricle means ear is called auricle, so therapy is called auricular therapy. In auricular therapy, the results are much faster and instant. And auricular therapy was invented just about 50 years back. It was only 1951 that a French neurologist, when he did corte to a patient in the ear, the sciatica problem got recovered. He found that there are some points called as reflex point or auricular points on the ear. Those could help treating the patient. In 1957, he gave a concept of inverted baby. I'll explain later in other video that there are few points. He gave 100 points. And in 1990, the case went to WHO. This is the therapy which was taken to WHO. In 1990, only about 40 years back, not very old, 43 points were selected by WHO and remaining points were rejected. And I appreciate when few points are rejected. When few points are rejected, that therapy will come up and up. That will be improved. Many scientists, many therapists, many doctors worked upon it. And WHO recommended it to dentists, physiotherapists, naturopaths, nurses, doctors to take the advantage of this therapy also. What are the advantages of this therapy? It is the fastest growing compared to other therapies. If I compare it in a relative sense, this is the fastest growing therapy in the world. Number two, results are very instant. Sometimes the moment we start treating the patient, the patient gets the results immediately. And sometimes it is difficult to believe how the results can be so fast, so early, so instant. It's difficult to believe even. And sometimes we are unable to explain it even. And the third point is, the relapse of problem is very less. If we really go to the root cause, relapse of the problem is too less compared to other therapies. Disease do not come again compared to other therapies. And next point is, the expenses are not too much. There are auricular sheets. One sheet costs around 20 paisa only. Suppose you use 10 points, 15 points on both the ears, 2, 3, 4 rupees, you treat the patient. And less time consuming. Compared to acupressure, you have to work upon the whole body, and many times you have to massage it or everything. It takes a lot of time. One patient takes 30, 40 minutes in acupressure. But in auricular therapy, if we are perfect, it takes 10, 15 minutes only. And one thing very important, there are many landmarks in the ear. Compared to body, there are many landmarks. More the landmarks, easier it is to treat by a therapist, and easier it is patient to understand the problem. And next thing, no physical force required. It is very easy to use the point. You don't need to use force. Anybody can do it. And but very important point is, this therapy is to be given once in 4, 5, 6, 7 days. You have to use once in 4, 5, 7 days, and the patient has to come only in 1, 5, 7 days. Means it's good to both to the patient as well as to the therapist. You don't need to, patient don't need to come daily to you. And another important point, very important point is, since the treatment is given on the ears, hands are free to use. Patient can do any work, any routine work in the day-to-day life. Compared to, for example, stroke, you put sheets or needle here. Patient goes to home, he or she has to do a lot of work, has to go to washroom, many things, job day-to-day working. The sheets get down or fall away, or the magnets fall away. So that's the reason results get less. But in the case, in auricular therapy, sheets are put on the ear. Sheets remain on the ear. They don't fall down. So results are better. And one more plus point with this therapy. It is scientific therapy. This is therapy which went to WHO. And it is all logical scientific explanation. And many scientists, doctors, therapists has written many books. There may be difference of opinion among the books, but I appreciate if there is difference of opinion among the different books, that therapy will emerge better and better. Criticism improves the therapy. More the criticism, better therapy will be. So look into all these aspects. I appreciate this therapy. Results are very good, far more instant. And if you are a therapist, you must learn this therapy along with other therapies. I always say learn many therapies, but you must not ignore auricular therapy. It has instant results and it has far better future than any other therapy. So this was all about how to note the history of the patient. Thank you very much.